Wonderful. Thank you. Thank you for inviting me to be here. I'm really excited to talk with you today. So I'm going to talk about ways that we can improve diet through evidence-based policy. And I'm going to assume that we're all on the same page with the 30-second obesity is a problem. We know it's an enormous public health issue, so I'm not going to go through the epidemiology of that. I just want to point out a couple of features of the food environment that I've been focused on when thinking about how do we change behavior and try to shape choices so people make healthier choices. So we know right now in the current food environment that nutrient-poor, energy-dense foods are widely available. They're not clearly labeled. They're heavily marketed. They're served in these giant portions, and that tends to promote overconsumption. And they're cheap. So those are just a few features of the environment that tend to promote overconsumption of less healthy foods. I'm going to focus on these three right here in the talk today and just share a little bit of some food policies that have been designed to try to address these issues in the environment and how they impact consumers. So an approach I've been taking in my research in the last few years is something that my colleagues and I call strategic science. It's a little bit different than traditional scientific inquiry. So strategic science means that you're trying to do really highly policy relevant work. And one of the best ways to do that is to actually talk to someone who's in a position to influence policy. So it could be, and we'll call these people change agents. It could be a legislator, it could be an attorney general, a regulator, an advocacy group. And think about what questions they have so that when you're crafting your scientific questions, you're building in their ideas so that the study you craft has the biggest potential to impact policy. Normally what happens in science is it's driven solely by curiosity, right? What you're interested in, what other colleagues think. So this is just introducing, you've got the curiosity piece, but introducing the policymaker, the change agent into the conversation. And so what we've been doing is trying to develop strategic questions together with change agents when we can. Obviously, then conducting really rigorous scientific scholarship is always the goal. But strategic science also has a very heavy emphasis on communicating. So taking the results and then communicating it back to those change agents who can actually do something with the data and design policies with evidence in mind. So obviously, if you have those relationships at the outset, it's a lot easier to go back and say, hey, here's what we found. Do it, use the data. So today I'm going to talk about a few examples of strategic science in my own work. So we'll talk about several different food policies. The first one will be menu labeling. The second, we'll talk about front-of-package food labeling. We'll talk a little bit about child-targeted marketing. And I'll end, just to give you a sense of what I'm working on now, and just a little bit around policies to curb sugary drink intake. So let's start with menu labeling, the first policy. First of all, what is it? Menu labeling is putting calorie information on a restaurant menu so it's highly visible at the point of purchase. This is a menu from New York City. If you've walked around New York, been into chain restaurants, you'd see this kind of information up there. So first of all, why would someone want to do a policy like this? Well, the rationale for menu labeling is that people eat out a lot, and we know that eating out is associated with weight gain. We also know that people don't know the calories in restaurant food. We're notoriously bad at estimating the calories. And the thought is, if they did know, they'd make lower calorie choices at least some of the time. So that's the rationale behind the policy. So let's just test some of these ideas. So people don't know the calories in restaurant food. I'm going to put you guys to the test here. So these are the Chili's classic nachos, and I want you to think in your head how many calories and how much fat are in these. But I'm going to give you a little bit of information to anchor you. So just think the average person should have about 2,000 calories a day and should have less than 65 grams of fat. So get some numbers in mind. Anyone want to venture a guess? You can just shout it out. Yeah? 600, 650? 1720 calories, 108 grams of fat. Yeah, isn't that crazy? Okay, but now there's a learning process here, so we'll do another one. The Outback Aussie cheese fries. Make sure you factor in that cheese on the side there. Any thoughts?
3,000 calories.
Right. You're learning. It's not quite that egregious. 1973 and 133 grams of fat, so almost 2,000 calories. Okay, so then what someone could say is, yes, but if someone wants to eat healthfully, they could go to a restaurant and order a salad, right? So this is the Chevy's tostada salad without dressing, to be conservative. So give me a guess. What do you guys think? 50. Ooh, Very nice. Yep, 1,500 calories, 91 grams of fat. Right, so it's really hard because even if you have good intentions, so you just don't expect your salad to necessarily have 1,500 calories. So that's the idea, and there's lots of research showing that we're all pretty bad at trying to estimate those calories. Even trained nutritionists have trouble doing it. So I want to tell you the story of this policy. So it gets introduced by the New York City Board of Health in 2006, and the restaurant industry actually really strongly opposed it, and they sued twice at that time. One of the arguments they made was, you know what, we already make nutrition information available. It's in our restaurants or chain restaurants. If you want access to it, you can pick up a pamphlet, for example. So at the time, as a researcher, I thought, okay, that's interesting. I'm interested in this policy question. That's a fair point. We can actually gather data to see, are people making use of that information? Do we have to bother with this big policy? Maybe people are getting the information. So we did this study where we counted people. We went to these chain restaurants, McDonald's, Starbucks, Burger King, Au Bon Pain, and we counted all people going into the restaurant. We did this at an urban location and a suburban location, and we did breakfast, lunch, and dinner counts. So what would happen is you'd walk through the door, we'd click you off, and then we looked to see how many people actually access nutrition information in the restaurant. So they had to pick up one of the pamphlets that was available, or they could look at a poster on the wall that had the information. And if they looked at that poster for 3 seconds, we said, okay, you accessed the information, you availed yourself of it. So we had a very low bar. We counted 4,311 people. How many do you think looked at nutrition information? 300? 400? 1,200? 6. 6, yeah. I mean, my hypothesis was that, that it was not going to be a ton of people, but I did not actually think it would be this low. It's only 6 people. People often ask, like, who are those 6 people? We did not intercept them and do interviews or anything. I don't know what was going through their mind. So the idea there in my mind was, you know what? Clearly, the way we're trying to disseminate this information, it's not getting out there. And so if we care about people being informed and having this knowledge, we probably have to do something else, like calorie labeling. But then there's this other part of the rationale, which is if we give people this information, they're going to make lower calorie choices. And so here's an example where the policy wasn't happening in the real world. We couldn't do like pre-post evaluations of it yet. But these discussions were happening, and we wanted to bring some data to bear. So we thought, all right, we can test this in a restaurant lab setting. So I'll describe for you what we did. At the time I was in New Haven, so we had 300 adults from the New Haven community come in, and we told them we were doing consumer market research, that we were working with a restaurant in downtown New Haven, which was not true, but they didn't know that up front. We told them later that that wasn't the case. So what happened is they came in thinking they were going to do this sort of focus group study about restaurants. So they would be doing the focus group, and then halfway through, we passed out menus, and we randomized them to one of 3 menu conditions, and I'll show you in a moment what those looked like. And the idea was we really cared about what they were going to order for dinner. So they're doing the focus group, they get the menu, they order their food. We run down the street and do takeout. We buy all the food, we bring it back to the lab, we weigh everything. We give it to them, they eat their dinner, we weigh it again. Now they don't know it's being weighed, but that lets us calculate exactly how much they ate at the dinner. Then there was one more part to the study. We asked them to come back the next day. They didn't know why, but when they got there, we asked them to tell us everything they had eaten later that night, right? So they had dinner with us. What happened afterwards? Did you snack on anything? And we did a dietary recall interview with them. Okay, so to give you a sense of the sample, actually 93% of people came back the next day. We had a monetary incentive. It was a community group, half female. The cutoff for overweight is 25 kilograms, so we had actually a pretty nice spread in terms of weight range, and a fairly racially and ethnically diverse sample. Okay, so the conditions that they were assigned to. The first one was a menu without calorie labels. This was actually a fold-out menu with quite a few items. I'm just showing you a little sliver here. So this is our control group, menu without calorie labels. Then we've got a menu with calorie labels. And then we thought, the calorie labels, these numbers might not be all that helpful without some sort of context. And so what if we put the information in context? So we add this label that says the recommended daily caloric intake for an average adult is 2,000 calories. And maybe that would help people understand the information and be more impactful. So let me show you the outcomes that we cared about in this study. The first is the calories people are ordering for dinner, and you can see the conditions at the bottom. So when no calorie labels are on there, they're ordering about 2,200 calories on average. With the labels, they're ordering significantly fewer, 1,860. And then calories plus context looks very similar. So no difference between the two calorie groups, but overall it seems to be encouraging fewer calories being ordered. What we really care about is how much they're eating. Did you have a question?
I was wondering if on menu and drinks and those also have calories.
Yes. Yeah, so everything had calories on it, but yeah, it was your traditional menu, appetizers, sides, drinks, desserts, yeah, the whole fare. Okay, so calories eaten at the dinner meal. No labels on the menu, they're eating about 1,450 calories. When calorie labels are on the menu, 1,300, closer to 1,300, calories plus context, getting down to 1,250. This is not statistically significant. I will show you that if we combine the two calorie label groups, you see the difference here, about 1,450 versus 1,289. This is statistically significant. So it's not a huge effect, but the labels do seem to be encouraging them to eat fewer calories. Okay, but remember we had this other part to the study where they told us, they came back the next day and told us everything they ate later that night. So we estimated the calories they ate later that night. When no labels are on the menu, they eat about 179 calories. When the calorie labels are on the menu, they go home. They eat more, they compensate, and they end up eating significantly more calories later. Does not happen with the calories plus context. And so we start to think, man, maybe there's something really important about putting that 2,000 calorie statement on there to give them a sense of calories in a whole day, and then they're not eating as much later. So I was a little bit worried about estimating calories because sometimes it can be tricky, a little inaccurate. I said, let's just look at the data one other way. What if we just look at they had a snack or they didn't have a snack when they went home to kind of confirm this finding? And what you can see is it plays out in the same way, right? So if the calorie labels, 70% of those in the calorie labels group go home and have something, and you can see it's much fewer in the calories plus context group, and that's actually the lowest group even relative to the control group. Okay, so the whole story of this study, the most we can learn from it is if we add the calories they had at dinner with the calories they ate later. And what you really see there is no difference when calorie labels are on the menu. Where you get the difference is with the calories plus context, 250 calorie difference on average. So that's, that's important to figure out that's this kind of subtle change to the menu, but it could have really important implications for how this policy works. We were also curious, people did seem to be ordering differently, so how were they ordering differently when labels were on the menu? And we actually didn't see any differences in percentage of people ordering beverages or desserts. Where we saw the difference is actually in appetizers and side dishes. So people were less likely to order those kinds of dishes with calorie labels on the menu. Now, my interpretation of this is just speculation, is I think with beverages are not so crazy in terms of their calorie content. There's not 3,000 calorie beverages, right? And desserts, you sort of expect desserts to be high in calories. I think the appetizers and sides, I mean, we have appetizers on there, and this reflects many chain restaurants of 1,500 calories, some are 2,000, and many of them are starting your meal. So I think you get more movement there because it's more shocking, sort of. Your expectation is kind of violated in that sense. So the bottom line here is, from this study, is calorie labels did seem to lead to people ordering fewer calories, eating fewer calories, but it was really important to have that contextual statement on the menu to prevent that overeating later. So let's talk about what happened with the policy. So calorie labeling ended up getting passed as part of the Patient Protection and Affordable Care Act. At the time, we had these data, and we were in contact with the legislators writing that bill, so we were able to say, look, it's one study, but there's not many others out there, and we're getting this finding, this 2,000 calorie label might be really important, and so think about that. And what ended up happening now is, and it took about 4 years for them to sort out the regulations. This should be implemented by the end of this year. Chain restaurants with 20 or more locations across the country are going to have to post calorie information. And in the FDA regulation is this requirement to have a 2,000 calorie statement. They're playing around with the language. So one idea is 2,000 calories a day is used for general nutrition advice, but calorie needs vary. I don't love it. It's a little complicated, and you could imagine testing and figuring out what the best way to communicate this would be. And there's other worries too. This is an imperfect number, right? Some people need less than that. You worry a bit about kids. Like I'm interested in what if you anchor them to 2,000, but kids need many fewer. And so there are all these other interesting questions just about how to design this policy and the optimal way to get the information out there. So this was the big announcement that the FDA finally released the regulations. So I want to step back, because I've shown you one study, but there's now been a number of studies on menu labeling, and you might have seen talk of this in the news. And so the question I get a lot is, does menu labeling work? And I want to walk you through the way I think about this based on my read of the literature. I've read all these papers out there on it. And if you're interested, what I'll share today, we've written up in a short piece in JAMA, my colleague Jason Block and I, sort of talking about how we think about this policy. And the points we're making are that there's a few points. The first is, the very first goal of a policy like this, calorie labeling, is simply to inform consumers, right? Even in the absence of behavior change, the idea is people don't have this knowledge and they need it. And we saw that, right? People aren't great at estimating this. And there's certainly a history of doing this on, clothing labels and cleaning products, the nutrition facts label on packaged foods. The other thing to think about this policy is, unlike a lot of other policies, food policies that are more controversial, it has overwhelming public support. People really like calorie labeling. In national polls, you see 70%, 80% of people supporting it. And I think the reality is sometimes the media has sort of covered calorie labeling as, this is a failed policy, it's not going to work. But I think we have to be realistic about our expectations of policies. No one policy is going to impact everyone all the time, right? So I think what the literature is showing, it's quite mixed, and what it's showing is it seems to be a policy that works some of the time for some people, right? It encourages lower calorie choices some percentage of the time at certain restaurants. And we still don't have long-term data on it. It has not rolled out nationally yet, so we don't know how this will evolve over time. The other point I want to make about it, we tend to think with consumer behavior change a lot about nudging people, changing individuals' behaviors. What's interesting about this policy is the potential it might have to change the industry's behavior, right? So it's a disclosure policy, and what you might see is that the industry, sort of embarrassed by the 1,500 calorie salad, and now that it's out there, they might want to offer the 1,200 calorie salad, eventually the 1,000 calorie salad, and so on, right? So it really might prompt them to offer healthier choices. Now, if that happens, that is a much bigger public health impact, right, than any sort of individual behavior change. So that's something that myself, other colleagues, are tracking restaurant industry behavior over time in this way. And I think basically it's a first step, right? No one thinks this is going to solve obesity, but we've implemented very few policies. And so at least this is something that is trying to target the food environment and do something different. OK, so yeah, please.
I have a vague recollection of there being talk that it actually had the reverse impact in certain segments of the population. So in segments of the population that are sort of lower SES, sort of, the narrative is they show up to McDonald's and they're like, well, I have enough money to buy, sort of one meal, and all of these calories on here are showing me where I should be using that $5 bill.
Right.
Has that been shown to be proven, or
yeah,
what's the state of that?
So probably the best done study in a low-income group, it did not see that reverse effect. I mean, it was not a significant effect. Even if there's a slight hint, it was unclear that that was really happening. It basically saw no effect, right? So it wasn't that it was having a negative impact, it just looked like it wasn't having much of an impact. And I think this is a great point, right? This is probably a policy in the lower income areas. It doesn't seem to be as effective, right? And it's a policy that is relying heavily on knowledge and understanding and numeracy and literacy. And so I think that's important to know, right? It makes the case that we need to be doing other policies. This can't be the only one. There's one study that did find a reliable effect among, it was a lab study and with male adolescents. Boys. Male adolescent boys are really interesting. They tend to just eat a lot, and not necessarily, not always that in the sense of like, it's always leading to obesity. They're just a group that tends to be really hungry, eat a lot of food. So it's a little hard to know. So a colleague of mine, Jason Block, is collecting data now with a much larger sample in the real world of male adolescents to try to figure out, is that a group that actually does have a negative effect? But right now, there's nothing really clear and reliable that it is hurting anyone. But it's something we have to measure and look out for. Great point. OK, so that's one food policy, calorie labeling. I'm going to switch gears. I'm going to talk about front of package labeling. It's still in this labeling theme. I should say, sometimes I get the question of, yeah, but labeling, it's still informing consumers. It's not doing enough. And I'm not studying these policies because I think they are the single best thing we can be doing. I'm studying them because it's what we're doing. And so if we're going to do it, we should do it well. And I do think labeling is important in one part of the puzzle. Okay, so front of package labeling, what do I mean by that? It's what's happened in this country is basically different food manufacturers have put labels on packaged foods to try to alert consumers to different health attributes of products. But it's not been regulated, right? So like something like health claims has been regulated, this is not. So basically companies can kind of do whatever they want. So it looks like this. You can see like a check mark, a smart spot, all these different types of labels. So this came to a head, and there was big discussion in this country because of the program Smart Choices, which you might have seen in the store. It was released for a brief period. And what happened was the Keystone Center got a bunch of people together, academics, nutritionists, different people in the space and the food industry to come up with a uniform labeling system that would alert consumers to smart choices, better for you products. It looked like this. There was a check mark, and it had calorie information on there. So in principle, this is a great idea, right? You don't have to look at that complicated nutrition facts label. It's right there on the front, something quick that you can get. But what ended up happening, this gets released in August 2009, this little check mark, and what are some of the products that it appears on? Cookie Crisp cereal, Hellmann's mayonnaise, Lucky Charms. Good news, these are smart choices. So certainly public health was concerned. Like these at face value seem like really not great choices. And so a couple of interesting things happened here policy-wise. So the FDA sent, I put that up there. That's my name for it. They sent a letter that was essentially like, we're going to monitor this program and make sure that maybe it's just a few products, but make sure this isn't misleading consumers. So that happened. Then there was a lot of kind of media outcry around this, a lot of suspicion around Fruit Loops and this program. What's going on? Is this misleading people? So this was a moment of a strategic science moment for us, where the Smart Choices program put up a website immediately, and they listed the products that were part of the program on that website. So we mobilized quickly, and we randomly sampled from 8 packaged food categories on that website. And we got 100 of those products, and we got their nutrition information. Because the question here is, maybe in general, overall, this is a really good program, and there's just a couple of dud products, or maybe a lot of them are not so great. So we get these 100 products, and we classify them as healthy based on an objective nutrition standard. So this is a standard that the industry didn't develop. The industry was involved in the Smart Choices nutrition criteria. This was a panel of academics who weren't involved. And this is actually, it's a model. It's called the nutrient profile model. It's been validated with nutritionists, and they actually use it to determine what foods can be advertised during children's television programming in the UK. So we applied that standard to the Smart Choices products. And the finding here is basically 64% of the products that we sampled from that website did not meet that criteria, right? So that's worrisome, right? You have over half the products in this program that are supposed to be smart choices. I mean, it's a huge public health concern that's getting rolled out on tons of food products all over the country. Yeah.
The per serving, do people multiply per serving versus the number of servings?
Yeah, I'm actually going to talk about that in a minute and show some data. So a lot of people, so those kinds of things trip a lot of people up, because they don't always do that, right? Yeah. So second study, kind of strategic study on this at the time. So we were also curious, how would the label impact behavior? So we knew that the criteria maybe wasn't so great, but how would it influence consumers? So we did another one of these consumer market research studies where we got about 200 people from the community, and we randomized them to 3 different labels, which I'll show you in a minute. We did the same thing. This time it was a breakfast study. So we're conducting this focus group about this cereal, but what we really care about is your behavior and perceptions based on your label condition. So people come in, they have breakfast with us, they pour their cereal, they eat their cereal, then they answer some questionnaires. So let me show you what they get randomized to. This was our cereal, Rainbow Treasures. I should tell you that when we're doing these fake focus groups, I had a question in there about the parrot, and a good number of people did not like the parrot. So that's a secondary finding. All right, so people get randomized in this study to a no-label control group where they just have this cereal without the label, or a group where it's the exact Smart Choices label as it had been released with this 120 calories per serving, 11 servings per package. And then we were worried about, can people understand that? So we thought, what if we just do something subtle and we do 120 calories per 3/4 cup serving to give people a sense of, because what is a serving, right? So maybe a cup, people could imagine that better than this 11 servings per package thing. So we're curious about that. Okay, so the first outcome is simply, we ask them, how healthy do you think this product is? And it's this scale, this 0 to 9 scale across groups. And what I'll show you here is actually when the Smart Choices label is on this not very healthy cereal, it gives it a bit of a boost. So they do think it's healthier, which is a worry because it's not. And this Smart Choices, this 3/4 cup, it tends to mitigate that a little bit. And this isn't a huge effect, so I don't want to make a lot out of it, but there's this hint that, if anything, the label is going to boost perceptions of healthfulness for a product that's not so great. Okay, we didn't see any differences in perception of taste, likelihood to want to buy the cereal, perceptions of sugar or vitamins in the cereal, so the label wasn't doing that much. In terms of people's ability to estimate calories per serving, because that's very prominent and clear on the label, what you see is, this is the percentage who's correct. So you had to, it says 120 calories on the label, so we only coded it as correct if you said 120 calories. And you can basically see that if we care about informing consumers, if you put that information on there, it does double the percentage of people who know now how many calories are in it. So at a minimum, it's doing that. But of course, I always really care about behavior and get excited when we can capture behavior. And so we wanted to look at how much cereal people were pouring, then how much they ate. And basically, no differences in terms of how much they're pouring. What I will show you is that line represents in grams the serving size, what is recommended to pour. So it's kind of funny that everyone's pouring over that. And actually, the FDA right now is thinking about, should they change serving sizes? Because they don't seem to reflect what people are actually eating. And it's kind of an interesting empirical question. If you do that, for the percentage of people who even look at that, does it encourage overeating if you make the serving size bigger? And so they're thinking about that. And then we also didn't see, this is amount eaten in grams. We didn't see any differences. The label did not impact how much they were eating. So basically from this study, this Smart Choices label, there's this hint that it might increase perceptions of health for unhealthy products. It did improve people's ability to estimate calories. It's really unclear how much it would influence purchasing or eating behavior. Now, we don't have purchasing data in this study, so I think the eating behavior data is a little more reliable. You'd really need, if it got rolled out, to see how it was influencing product purchases in the store. But the point is, we're trying to do this research in a timely way while this discussion is happening. So now let's come back to what's happening with this program. So the FDA had sent that letter, and they basically, as the program's getting rolled out, they're like, you know what? There should be a front of package labeling initiative. And actually, Congress charges the Institute of Medicine to write 2 big reports on the topic to make recommendations for what an ideal labeling system might look like. What was fascinating about this is that in Connecticut, Dick Blumenthal was the Attorney General at the time, and he was very worried that it was misleading consumers. And so he ended up, we connected with him around this, and we said, look, we have some data. Remember, I showed you those 64% of products. So we have some data to back up that this really does not look objectively good. And then he came out and threatened investigation into the program. And it was really very powerful. So basically, once the Attorney General stepped up, a couple months later, Smart Choices program halts. So this is actually kind of a really neat public health victory where there wasn't a big lawsuit or all this stuff. It was the combination of the media came in, this Attorney General was a public health champion. We had some data to share with him, and it prevented this program from really rolling out and being sustained. But what's fascinating, the story goes on, right? So the Institute of Medicine does write 2 reports on the topic. The first one is just about the nutritional criteria that should underlie a front of package labeling system. So they released that one, and then they're working on their second report. And the industry said, we're going to wait for the Institute of Medicine. We're going to wait for some recommendations. But they didn't wait, actually. Shortly thereafter, they released a new labeling system, which you will see in stores now and might look familiar to you. It's called Facts Up Front. And it looks like this, right? So if you care about behavior change in communication, you worry about a labeling system like this. You can, just start thinking in your head, what jumps out to you? Any concerns, thoughts? What's that? Overload, yeah. A lot of information, right? And a lot of numbers, grams, milligrams, percentages. The industry can also pick 2 nutrients to highlight that, the potassium or vitamin A, 2 positive nutrients. So there is worry. I mean, it's good. We want to inform consumers, but there's probably a better way to do this. And so I'll just give you one example here, and I have this red means stop because people have been experimenting with a traffic light kind of labeling system. And the idea behind it is this is so intuitive, it's so easy to understand, you sort of instantly code it. Red means stop, green means go. And so the idea, if you care about behavior change, we think a lot about all these little details. There are probably ways to communicate this that can be much more impactful. And there are some good data on cafeteria studies showing that traffic lights can prompt healthier purchases. So that would just be an example of, can we do better than facts up front? Can we simplify it? The other point I want to make, I put this up here. This is a picture of my breakfast cereal one morning. I don't know if you can spot, I'll show you what's on the front of the package. It's 4 wholesome grains. I don't know if you can spot the facts up front label. It's there. And so the other worry is just how it's being implemented. Right? It's on the top of the box, which might be fine by the time it gets into your house, but when you're making a purchase, if you'd like it to influence people there, that's not going to do very much. Okay, so just to give you an idea of what else is happening, the Institute of Medicine did finish that report, and they released it. And one thing they suggested was a graded star type of symbol. So this is something that's being debated, where you might do 1, 2, or 3 stars for healthier products. Now, nothing's happened in this country at this point. We don't know if we'll get to a point where we have a mandated labeling system. Other countries are moving in that direction. Some have implemented voluntary programs, some are mandatory. So it'll be interesting to see just how this evolves over time. And you can see we're actually doing studies. This just gives you an idea of there's a whole range and interesting questions you can ask just around how best to communicate it. 1 traffic light, multiple traffic lights, stars, a single number. And so we're doing those kinds of tests in my lab. Yeah.
Are you studying the impact that this is having in the countries where it's mandated?
Yeah, so actually, if you know Michael Hiscox at the Kennedy School, he's got a partnership with a supermarket in Australia, and it looks like they have a 5-star voluntary system right now. And so it looks like we're going to be able to get some data from them on that, which will be really, really interesting. Okay, so that's some of the labeling stuff. Let's talk a little bit about food marketing, both child-targeted food marketing for less healthy foods and then using food marketing to promote healthier foods. All right, so what does child-targeted food marketing look like nowadays? It's been this way for a while, right? There's all these really engaging child's toys that are branded. Certainly these companies are very savvy about social media. Using celebrities or athletes is another very common way to try to target teens and young children to promote products. You can see the athlete one there. We've done some research on the athlete one. It's kind of a fascinating one to me because, right, it's the chances of these athletes, consuming these foods that they're promoting as often as it might seem is just so unlikely relative to what they're doing athletically. So it's just it seems very ironic. But I want to talk about one particular type of advertising I've been focused on in the last few years, and it's something called character licensing. So companies spend just on this strategy $208 million a year just for this one strategy. And it looks like this, right? It's licensing these very popular characters to promote foods that aren't so healthy. But there is this movement, this idea of, could we use those same strategies to promote healthier foods? And so this was an example from a few years ago of marketing baby carrots. And the idea is eat them like junk food. Like, let's package them and market them as though they're a junk food. So people have gotten interested in doing this kind of thing. So we did a study with 40 4 to 6-year-old preschoolers. They're about 5 years old on average, a fairly racially and ethnically diverse sample. And we went into the school. And what we did was we had the kids taste 3 pairs of identical foods. There were graham crackers, fruit snacks, and carrots. And the package either did or did not have a character. And we used these 3 guys because they're some of the most popular ones used on food products. So I always joke, this was a study I actually did in grad school, and the budget was kind of low, so we made these packages ourselves. But I think they're pretty cute. So I want you to imagine this. So we're standing in front of the little kid. We've got 2 bags of carrots. They're the exact same carrots. One has a character on it, one does not. And the kid takes a bite of each one, and they have to tell us which one tastes better, or they can say they taste the same, which is the right answer, right? And then they pick the one they want for snack. So we do that with each of the foods. Okay, so here are the results for the graham crackers, for the kids' taste preference. So this is the percentage. So 7.5% of the kids think the no character graham crackers taste better. 38% think they taste the same. significantly more kids think the same food tastes better if a character is on it. Just to give you a sense of how powerful these influences are for kids. For the snack choice, overwhelming majority of kids want the graham cracker character snacks, right? 88%, so really big effect. Same exact finding for the gummy fruit snacks, so I'll go through it quickly. You can just see the pattern is there. Significantly more kids think the character fruit snacks taste better even though they're the same food. Again, we replicate majority of kids want the character fruit snacks. Baby carrots, similar finding. Now this is a very small sample, so we didn't quite hit statistical significance, although we end up replicating this study and do get a significant finding. But it is kind of interesting. It's not quite as stark. So there are 25% of kids do like the no character carrots, 25% think they taste the same, and then 50% think the character carrots. But it did start, I started to think, you know, it's interesting, will these kinds of strategies work as well for less healthy foods? And that's an open question. Now when it comes to snack choice, still 73% of kids want the character carrots for snack. I'll just show you one bit of data. So we replicated this study in Guatemala, which is an interesting country. It struggles with undernutrition historically, but now this issue of overnutrition is growing and obesity growing in that country. And there's very little data. So we've got some of the first data on how food marketing impacts kids there. So we increased our sample size and our age range for this study. We used some different foods and some different characters. El Chavo is actually a very popular character down there. And I'll just show you the snapshot of the baby carrot finding where we do get a similar effect. 33% of kids like the no character carrots, 16% think they taste the same, and then 51% think the character carrots taste better. It's not quite as strong though as in the US. And again, they do want the character carrots for snack, but again, the effect is not as strong as we saw in the US sample. So one question is, and it's some people find, you know, it's an ethical question, it's an interesting question because people feel very differently. People are even torn in public health about this, but should characters be used to promote healthy food? And I have this up here because Michelle Obama did broker a deal with Sesame Street. This is a picture of the negotiation, where they basically, Sesame Street agreed to license their characters for 2 years for free to sell fruits and vegetables. So it's going to be interesting to see what that purchasing data looks like and does it have an impact on increasing sales. So I'm going to end just to give you a flavor. There's no data here, but just a sense of stuff I have going on in the lab and how we're thinking about new food policies. So we're doing some strategic science around sugary drink policies. One of them is the New York City Board of Health's proposal a couple of years ago to limit the portion sizes of sugary drinks. So that got voted down, but it got voted down because they said the New York City Board of Health didn't have the authority to pass that policy, but a city council could pass it. So it's still this interesting, viable policy idea. So we're studying this in a bunch of different ways. We've got some field data on it. We're doing some lab studies and a variety of framing studies around support for the policy. And then one thing I'm really excited about right now is work we're doing around warning labels on sugary drinks. So a bill was proposed in New York. There's one in California. The hearing is next week in California. And it's this idea of, you know, what happens if we put warning labels on sugary drinks? We don't have any data on it. We've done it with tobacco. And so we're running studies now to figure out, is it going to influence consumers? And also, how should these labels be phrased? We're tweaking the language and trying to see are certain labels more effective than others. And so that's a strategic science policy where I've been talking to an advocacy group. They've got their legal team to ensure I'm testing labels that are legally viable. We've got a panel of nutrition experts like Walter Willett making sure we're testing labels that reflect the science of nutrition. And then I'm the behavioral scientist trying to figure out, all right, how do we execute it? How do we communicate this in the best possible way? So I'll leave you with this thought of strategic science for evidence-based food policies. That's what I'm up to. I hope other people are excited about it. And just to acknowledge some various funders of the work. And then if you're interested, that's my lab website, and you can follow me on Twitter or check it out. You can always email me too. So thank you. I'd be happy to take questions. Yeah.
In the last few years, I've noticed that a lot of products in the stores are using the term natural, and things are generally being packaged in green packaging to advertise their health claims and not specifically talking at that point about nutritional impact or other things, like without the details. Just the idea of having something packaged in green sitting next to something packaged in red or some other
Yep.
colors changes perception in terms of when you're purchasing. And I was wondering if you guys had considered, because you were looking at what kinds of things and labels to put on the front of the package, if color was, I mean, you talked about the stoplights,
Right.
but if the whole package's color was something that had been explored or looked at in terms of disseminating that kind of information.
Yeah, so that's really fascinating. Color does have an impact. Actually, a friend and colleague of mine, the study you might be referring to, he was looking at label color and found that when the facts up front appeared on candy, a lot of the manufacturers put it in green, and people did perceive the candy to be healthier if it was in green relative to red or another package. So these subtle things can influence perceptions. And yes, companies are, actually I presented the health claims data to the Culinary Institute of America. And so there were some various industry people there, and one person came up to me and said, it's really interesting because we're really worried about lawsuits around this all natural claim because it's very ambiguous. He's like, and man, if it's not working terribly well on certain products, why bother using it at all? So it's hard. I mean, they certainly have the purchasing data to figure out how much those claims are helping them, but there's certainly a lot of controversy, and I do think those details matter. I myself haven't done color studies, but they also do this in tobacco, looking at tobacco packaging, like blue signaling healthier relative to other kinds of colors. So companies definitely do that. Yeah.
Also, maybe shelf placement, right? That's
Yes.
used and abused in all sorts of ways in terms of what they want to sell at that point.
Yeah, absolutely. No, shelf placement also has a huge impact. So companies pay a lot of money for those end cap aisles, right? Because they're very prominent, and so that's a great way to try to market products.
Hi, thanks so much for the talk. I was curious what your opinion is of understanding and accommodating business interests in both your research and also the ultimate policies. And the two things you showed that kind of triggered that in my mind were the stoplights, which I would think businesses would hate, but then also the 6 healthy grains with the nutrition label somewhere else, which made me think businesses are always going to have the ability to influence decisions no matter what's regulated.
Yeah, absolutely. So this is a constant tension. And yeah, I mean, the reality is businesses are operating under an environment where they're just highly incentivized to do this, right? They're not, people in these companies are not bad people. It's just that's the system. That's the nature of it. And we have all these biological vulnerabilities, psychological vulnerabilities to promote overconsumption. So there's always going to be that tension there. I do think there is an opportunity, and I've heard this from companies. I think there are a handful of companies who are feeling like there's money to be made by selling healthier food, and that consumers are getting more interested in that. And so in that sense, I don't think, that there's a misalignment as more time goes on and obesity becomes more and more part of the public consciousness. This supermarket in Australia that we're working with, they're doing a lot. I mean, they basically have adopted this perspective. And so I think there are those exciting opportunities where public health and business interests are aligned, but that's not always going to be the case. And so I think we need policy, and we need some of these voluntary efforts as well.
That was awesome. Thank you so much. That was so cool. I learned so much. One of the things that I was, I guess that was an unexpected takeaway for me was the fact that the calorie labeling doesn't seem to influence eating behavior in the first set of studies that you saw. So in terms of the amount of grams of cereal poured, showing sort of, somebody that there's 120 calories in this box versus you don't know on this box, it actually doesn't affect anything. So just in that study. So I have 2 questions for you flowing from that. One, what do you think the intention is from the perspective of the companies for putting those labels on there? And then 2, what studies have been done, or are there studies being done currently to test the effect on purchasing practices when you put calories and when you don't put calories?
Yeah, so right. So the calorie piece, there's two separate things happening. There's restaurant menu calorie labeling, and then there's just putting these labels on the front of packaged foods. And I do think we're probably going to see differences because many of the packaged foods don't have these high ticket items that restaurant meals do. I think people aren't as shocked. 120 calories is not that shocking. I don't think it's that meaningful on a cereal, but the 1,500 calories on the onion loaf. So I do think you want to think about those things are probably going to impact people differently. So then you're talking about the packaged food. Why do companies do it? A couple of reasons. I mean, there is, so what's happening, and this plays out in lots of different scenarios, but often when there is threat of regulation of some kind or companies come under fire, they tend to self-regulate, try to take steps to self-regulate, and so that they can avoid policy being implemented. And sometimes just that natural process of that happening is an effective way to get change. And so I think what a lot of these companies, this is true for the beverage industry, for example, they've done this Clear on Calories initiative where their bottles have the calorie information. And I think that's partly to say, we want to do something. We definitely don't want warning labels and some of these other taxes. So this is a way for us to do something, but it might not be ultimately all that impactful. I don't think the companies care so much that it's going to impact behavior, but it's a way to say, look, we've done something, we're informing people. Also, the US has a very interesting history and tradition, right? And this tends to be a place where people care a lot about individual freedom and rights. So people get on board with informed policies that are information provision policies, much more so than, say, taxes, portion limits. That was an unpopular policy. So I think they're trying to do something, but you said it, they're not going to be like, what we need to do, put a traffic light on there, which I completely understand. Of course they wouldn't want to do that. They don't want their sales of these beverages or foods to go down.
Then for that second part of the question, have there been studies?
Oh, right, the
to look at
purchasing.
Sort of, the difference of purchasing?
Yes, yeah, so it's tricky, and that, this is a methods kind of thing, that cereal study, we just looked at one product and one eating occasion, and so I try not to draw too many inferences about how it might impact eating behavior, because I think you want to do a whole series of studies with lots of different products. But there are some purchasing data out there. So there have been a handful of studies looking at front of package labeling. Not a ton, but there are some that show, for example, one supermarket has guiding stars with it's like a 3-star system, similar to what I showed you. And there are indications that those kinds of programs can move people to purchase healthier, foods with more stars. But that research is also mixed. Again, it might work for some product categories and not others. But there are a handful of papers that looked at purchasing data with some positive effects.
How does this work for a grocery store to require stars on their food? They just require that Coca-Cola prints this on their packages, or how does that work?
Yeah, so right. So if there's not a policy mandate, so actually this supermarket that we're working with the voluntary, it's their private label stuff, is what I should have said.
Okay.
So they're not requiring. Now, but other supermarkets like this Guiding Stars, they don't do front of pack labeling, they do shelf tag. So they can put it on their shelves, but not on the products. So that's another way.
And do you think that really is are they seeing this as in their business interest, or they're doing this because they just believe it's the right thing to do?
I think they think it's in their business interest. Yeah, absolutely. I think Jose Alvarez at HBS has a really nice case study with H-E-B supermarket. And he was saying, this is anecdotally, I don't have but they've done a lot of these shelf tag labeling systems, and what they've done there is particularly like, if you have hypertension, you need low sodium products, like they do tags like that to kind of help people think about, okay, well, I know I got to go for low sodium, try to tailor it to specific illnesses that you might have and certain dietary requirements. And he says they've seen really good impacts in terms of people liking that and wanting to buy products that are well labeled.
And second question, so outside of policy, in terms of things that are impacting eating behavior, is there anything that really excites you or worries you in terms of, technology or cultural shifts or anything like that?
Yeah, it's a good question. I guess, there are a lot of things happening. I mean, it's funny, I think so much about policy, so the first thing I would say is I am really excited about what's happening in policy because we're starting to have some victories around, I consider them victories, like we passed a soda tax in Berkeley, Mexico has a soda tax, different places are starting to do that. I am excited that I think more and more people in industry do think there's money to be made by promoting healthy food, and I think those incentives aligning is really powerful. Technology, I get a lot of people who come to me and with apps and ideas for that. I think I'm a little bit less excited about some of those because I think a lot of the population that needs to be targeted, it's just people don't, you've got to be very, very motivated to engage and that kind of thing. But I do think there's a neat opportunity for supermarkets and their online interfaces, like just to design those in ways. You could use a lot of psychology to design online shopping to really promote healthier purchases. I think that's very interesting, and there's starting to be more and more interest in that. Yeah. You guys, I would love to hear from you guys on technology ideas, and you probably know more about it than I do.
Not me.
Yeah.
It might be slightly off topic, but one of the most surprising things that I saw in the data that you showed was that in the cereal experiment that you held, so even if I look at all the possible interventions, the average of what people perceive was healthy was around 3 or 4.
Mm-hmm.
And I would love to think about myself that I would not consume, food which is, I don't know, under 5 or whatever.
Mm-hmm.
So I was wondering if you know what would be the factor that would go into people's mind when they're thinking on the utility of consuming or not consuming food, and if it is obviously not health, like maybe we should target that instead of, in order to influence their behavior.
Yeah, right. So I agree with this. So we know that people care most about taste and price, and that's just above health always. It's very rare. It's going to be a small subset of the population that's putting health number one. So you're right, and that's part of what I'm getting at with this health claims, and sort of bringing empirical data to bear on that we're looking at outcomes like purchase intent and deliciousness, because I think that really matters, and those touting health doesn't seem to be influencing that. So I agree with you. I don't think the best messaging is always going to be health messaging.
But price, for instance, can be. I mean, you can use taxes in order to to tax unhealthy food and stuff like that. Do you know if there's any study around that?
Yeah. So price. Yeah. So price does seem to be an effective lever. We know that can shape behavior, and there are some lab studies and cafeteria studies on that. And now that we've got some taxes live around the world, people are going to collect data. So I mean, when I think about it, right, it goes back to the first point. There's not going to be one solution. We're going to have to implement lots of different things, and I think using price levers like taxes are one really good way to try to shape behavior. And then, of course, you want to think, how can you complement that, or how can you make a tax even more effective with some of these behavioral ideas? I think those are exciting areas of research. Yeah.
Thank you. This is fascinating. I don't understand why there's maybe it's just the way the industry is organized, but there's so many dollars behind all these packaged foods and promotion of them and so forth. And it seems like there's so little promotion of just all the stuff that's not in the middle of the grocery store, the fruits and vegetables and unpackaged stuff. What would it take to get people, more excited about eating the unpackaged stuff, the natural fruits and vegetables, compared to all the stuff that seems to have all the corporate dollars behind it?
Yeah, what would get them excited? Probably corporate dollars behind it. Yeah, I mean, I think this is such a fundamental.
Is it because these are like little farms and they need, somebody to pull them together and put some money behind
what's
it,
happening,
or what?
What's kind of interesting is, like among produce, they compete with each other, right? So like the strawberry guys are not always keen to work with the apple guys or the grape guys because they have, they're sort of companies competing with each other. So it's not this sort of unified where there's just a few of these transnational fruit and vegetable corporations that have the dollars. And so that's part of it, that there's a lot of just conflict among, normal competition among them. They're not all sort of coming together because they're all selling these different
Is it
products.
true they really don't have the resources to do these big, if you imagine if they all got together and there were these celebrity campaigns, all the whatever that influence our teens and kids, their favorite rock stars and hip hop artists and athletes and whatever, and they all talked about eating, choosing the juicy pear or peach over the packaged, highly processed food. It might get the kids to think, I want to be like that, I want to have that. But it seems like they don't have the money or something to do that.
Exactly. I mean, they just don't have the dollars relative to all the other food marketing that's out there, right? So I think if you did this massive food marketing campaign with the proper amount of money behind it, you could make a significant dent. We're starting to see like the Sesame Street, some of these companies are saying, here, use it for free. We're trying to engage celebrities or athletes who just out of the kindness of their heart, will they promote this kind of thing? Because I do think it comes down to dollars in that case.
And also thinking of actually Jay Winston won't be able to be here next week like we'd hoped but he had done the campaign to get designated driver, and do you know him at Harvard?
No,
to get
no.
designated driver into common parlance, and by placing designated drivers in the popular TV shows, so that people saw that that was the cool thing to have, right? And if they could see that eating right was the cool thing, in all these media forms, then maybe that would be a way to influence a lot of people without it just being the advertisement moments being the main influence.
I totally agree. Because if you think about the big picture of advertising, I mean, it's everywhere, right? It's not just TV. I mean, so there are product placements, and I mean, it sort of seeps into life all over the place. And so, yeah, absolutely. I mean, I agree with that. If you could get the healthier food as prominent, I think that would have a huge effect. We know food marketing impacts people.
Thanks.
Oh, did you have?
Just to sort of continue that thought a little bit, it reminded me of, so I watch a lot of anime, and anytime people or characters eat food in anime, the food is actually like real food. People eating salmon, and there's rice, and there's vegetables. The meals, even in shows, are very detailed and actual real food. But if you watch any other TV shows here, normal snacks. I mean, I haven't seen any lately, so I don't know. But I'm imagining a lot of general media shows food being a burger and fries more than anything else. And I think that does have an impact in the long run of what people are seeing growing up, or just generally what they're associating as food is. I don't know if you've really noticed. I don't know about shows.
Is anime Japanese? Yeah, so I actually just wrote a paper this year with an anthropologist who studies Japan, and I learned a lot from her just about the food environment in Japan, which I knew very little about. Profoundly different culture around eating, and their obesity prevalence is very, very low. Now it is rising, but it went from like 2% to 4% relative to, relative to the rest of the world. So it's a fascinating place, and so that's really interesting that they would be portraying those kinds of foods in media.
Everything is marketed with a really cute character on it. Doesn't matter if vegetables are junk food.
Yeah, it's interesting. Yeah, no, Japan I think is doing a number. It seems to be doing a number of things right. It's hard to figure out what the active ingredients are, but that's an interesting anecdote.
Thank you for your talk. And I wanted to actually explore a little bit more along the lines of thinking about food in terms of calories. So it looked like a lot of the studies that you did was sort of centered around this paradigm of thinking about food in terms of calories. But I know that, for example, physiologically, our body reacts different. Like 1 calorie of sugar, 1 calorie of protein, 1 calorie of fat. Those are going to, change our bodies differently in different ways. And there are sort of these growing movements of, using different types of paradigms to think about food. So like the glycemic index, for example. I was wondering if you had done any studies on any of these alternative ways of looking at how you quantify, food, and then also what your opinion of sort of those alternative systems are compared to, what we use nowadays with calories.
Yeah, so it's a great point, and you're absolutely right. And part of, like I said, the reason I'm studying calories is because it's what's happening and policy-wise and what we're requiring, not because I think that is, the absolute best way to communicate it. It is very complicated with menu labeling. They were thinking about should we communicate other bits of information about food, but sugar and sodium, and they decided, well, calories is sort of the simplest one number to get out there. But you're right. I mean, it's part of the reason. It's kind of like with the traffic light studies. That's not saying anything about calories. It's just sort of saying here's in general a healthy food versus a less healthy food. And I do think those messages ultimately would be more effective than pure calorie information. But yeah, I mean, the nutrition science around this is growing. We're constantly learning new things. We're learning that not all calories are equal. And so it's hard because some of this is just, we've got a shot to give one message out there, and the hope is we learn and then we can change these messages over time, but sometimes they stick. But yeah, you're absolutely right. It's calories are not necessarily the most important or only thing to know about a food.
Have you looked at any of these newer labeling systems, like glycemic index, for example?
Yeah, so I haven't done anything based on the glycemic index. In some of the front of package labeling stuff, we test the traffic lights, we test NuVal, which is a single score that factors in a whole bunch of properties of a food. It's like from 1 to 100. So we've looked at that, or the stars, which are all trying to get away from just the calorie information. So we are running a study now. It's kind of like a horse race, putting them up against each other just to look at consumer perceptions. Actually, in that study, this is still preliminary, but NuVal actually came out on top in terms of consumers being able to understand it, use it, its impact on purchasing decisions.
Thanks.
Let's thank Christina.
Thank you.